Okay, so this is Dr. Todd Mexico, and I want to talk to you today about the main ideas behind using heat or ice therapy for an injury. So, two of the most common and effective methods of reducing aches and pains are applying heat or ice to the involved area. While these methods are very, very common, they are often misused. So, in order to understand which therapy is right for you, it is important to understand the effects that each, meaning ice or heat, has on your body when it is applied to an achy or painful area. So I want to talk about each one of them for a few minutes. Let's start with ice therapy first. So ice therapy. Ice therapy improves pain and inflammation by reducing the blood flow to the area that is applied to. It also numbs the area, which of course then decreases all sensations in that area, therefore reducing pain as well. So this next thing I'm going to mention is really, really important, so listen up. Most important thing that I'm going to tell you about the two. Ice is best used after a new injury for the first 24 to 72 hours. This is a time frame that's referred to as the acute phase response, and it is when most inflammation occurs, which is attempting to heal the damaged tissue. So also very important, make sure you use a thin layer of cloth between the ice pack and your skin. This is to avoid frostbite and or ice burns. So ice should be used for really no longer than 20 to 30 minutes for most practical applications. So it's okay to apply that ice pack several times per day, but make sure to remove it for at least an hour in between applications. So 20 to 30 minutes on, hour off. Okay, let's talk a little bit now about heat. So applying heat to the involved painful area conversely increases the blood flow and promotes even more inflammation, which relaxes the painful tissue. So heat should be used much more cautiously than ice for this reason, because you're actually promoting inflammation. People can usually tolerate much longer periods of heat than they can ice. So for this reason, they also tend to leave heat on for way, way, way too long. So as a general rule, heat should not be used for more than 15 minutes for application. And if you do put it on an area of painful stimulus, you want to make sure that you remove it as well as like you do with ice for at least an hour in between applications. So about 15 to 20 minutes on, hour off. I'm sure this will come as a shock to some people because I encounter patients in my practice all the time that tell me, oh, doc, I love heat. I fall asleep on my heating pad. But then they also tell me that they wake up in the morning feeling worse than they did the day before. And there's good reason for that. Again, while heat is very soothing and causes a localized relief in the pain temporarily, it does that by promoting inflammation. So we're getting more inflammatory mediators by increasing blood flow to the area. So remember that most tissues are in pain because they are already inflamed. So adding a heating pad to them for a long period of time can kind of be like the equivalent of pouring gasoline over an open flame. So couple of quick tips that I just want to share with you. Number one, if the area that you're treating increases in pain with the application of heat or ice, discontinue the use of both therapies immediately. Don't use them. Number two, never ever sleep on a hot or a cold pack. This will increase the risk of burns from either, and it can also, again, make your symptoms worse as we discussed previously. The third thing I want to mention to you again is use ice for new injuries. Remember, 24 to 72 hours, 1 to 3 days, and avoid heat during that time period. Number four, these are just general rules. In general, if you feel achy, stiff, or tight, consider using heat for that discomfort. Number five, in general, if you feel sharp, really sharp pain, consider using ice. And then when in doubt, always use ice before heat. So that's the main idea behind how to use ice therapy or heat therapy. Thank you for watching. And as always, please comment in the section below where you're watching from so I can see how many people I'm reaching and where I'm reaching. And if you like the information, please, please, please give it a share. It's the only way we're going to get the message out. So this is Dr. Todd Mexico again, and make it a great day.